Hey everybody, welcome to Keeping It 100, where we have these open and honest conversations to make sure you have what you need to make good health decisions. I am your host, Dr. Kristin Motley. We have a good show in store for today. Excuse my phone, the internet on campus is like not working, and so I have to join from my phone. But that is not going to make the conversation less popping. So just want to remind you all that Dr. Tyan Thomas is in the background. If you have questions along the way, I want to leave comments. She will be talking to you there. I'm not on my computer, so I can't see anything, but just leave them there for her and she'll look out. So let's go ahead and bring in Mr. George Mink Jr.
Hey, what's going on?
Hey.
Oh, you looking a little small over there, Doc.
I feel like I'm crooked. Like I'm trying to straighten. I don't know what's happening.
Yeah. It's all right.
It's a lot going on.
Right.
All right. I think I'm straight. I don't know. Anywho, how you doing?
All right. I'm good. How you feeling today?
I'm feeling good. Had class this morning. Didn't have to do much, which is the best classes when I just can show up and help out. So I'm on campus today. So just doing my thing, juggling and trying to survive.
Right. Well, I'm glad you're not coughing today. It's fine.
No, I ain't coughing.
Right.
I got some water, and just in case a cough try to come through.
Right.
I got some water today, so I'm good.
Okay.
How you living?
I'm good. Got some good stuff going on. Good morning to our viewers. Well, good afternoon now.
Everybody.
Just feeling good going into September.
Nice.
Trying to get everybody on board.
Yeah, I know. It's work, and y'all been putting in that work. I know you had an event over the weekend. I stopped by for a little bit. It was hot on Saturday.
Yeah. There's a little bit. It's on Africa out there. But no, it was a great event. It was a community block party and health fair sponsored by Eternal Hope of Glory Church. It's over there near the fairgrounds. Very nice event put together by Pastor Knowles and his church members and all the community leaders. Everybody was there. Shout out to all the great folks that came by the table. And great event. I mean, it was a little hot. I think what it was, we had a good week of low humidity, and then Saturday just snuck up and just smacked everybody. So
Saturday was like, got him. Y'all thought it was
pretty much.
We still in August.
Right.
Act like you know.
Right.
Yeah, it was hot.
Right.
I think we had some pictures from that event. I know I saw C's out there. That was good seeing him.
Oh yeah, my guy, my cousin.
Yeah,
he was out there. Little cousin's out there repping his team, the coalition. Shout out to the coalition. Angie from Boys and Girls Club, our good friends from Health Partners, Miss Denise from Keystone. I got a lot of friends now. I'm getting good friends. Yeah.
I heard everybody know you out there in
I'm moving around.
Streets. All the health,
I'm moving around.
Health fair streets.
I was in the fairgrounds and all that. But, it was a good event though. Good event. Got a lot of questions. Parents concerned. Pretty much, same stuff. Weighing to get the vaccination for their kids, for their self. I was able to get them real quality information. I did get some feedback from two of the people from Saturday. They're just weighing on getting the shot. I kind of convinced them to give me a call back. I sent them over some literature, that I had at home. And the mom is really considering getting her kids vaccinated just in case something goes wrong in school this year.
Yeah, nice.
And again, we're not really trying to get people to just go along with it. We want you to understand that it's literature to back up anything that we're saying.
Yes, so, don't just go along with anything.
Right. We're not trying to fool you. We don't want you to do anything you don't want to do. Oh, there we go. There go Angela, my cousin C's. What's going on, C's? But great event though. But again, that's me at the table. Of course, I did all that decoration by myself.
He did. I showed up. I was like,
getting good at that.
No,
I'm
because
getting
you be
good at
acting
this.
like you can't do it. And I'm like, George,
I
seriously, set
know.
that table up. I pulled up, the table was ready. I was like, see, you can
Uh-oh.
do
Now
it.
you know
Yeah.
you can't use that as an excuse anymore.
Right.
Exactly.
I hope you're growing up too, Ty. So I can't say that no
Exactly.
more.
No excuses. Set that table up and stop playing around.
Right. Right.
No, but you did a good job, Sarah. They thank
Okay.
you. But
All right.
yeah, so it is like don't just take our word. Read the information, look at the information, interpret it, digest it, consider it, and think about it for yourself, because this is a decision. And all the health topics that we talk about, these are decisions that you're making for yourself and for your family. So question us, challenge us, challenge whoever is giving you information. Don't just take anything that anyone says for face value. Look into it for yourself and get the facts.
Mm-hmm.
Get the facts, because there's a lot of chit chat going around that's just causing confusion, and it's intentional, and it's very unfortunate that people want to keep us in a confused state, but they do.
Mm-hmm.
But as much as we can, we're going to be out here just telling you the truth as we know it to be. That's
Right.
the best we can do.
Right.
So good job. I know that Francis was holding it down in Sharon Hill yesterday, so we had the whole county covered this weekend.
Oh yeah, we sure did. We had that event over in Sharon Hill Memorial Park. Um, like the African community, they put on a nice little event over there. We had a table. She's not here to represent us today, but she did get a couple questions from, from like the problem with her is that they're from another culture. So she was getting cultural questions. And it was kind of interesting, and she was able to give them literature that helped them at least go home and decide, because
Yeah,
they are in society, and they are, that kids still go to school with us even if they are from a different country. So
yeah, exactly.
yeah.
That's good. The information is the information. It's the same thing for all of us. We're
Mm-hmm.
all processing the same thing at the same time. But because cultures are different and the way we do things are different, we process it in a different way. And
Right.
it's okay. It's up to us, because organizations like ours, to meet people where they are
Mm-hmm.
and to share what they need to share in the way that's helpful for them. And
Right.
so we just have to be able to adapt in whatever community that we're talking to and trying to educate or engage, then we adapt to that community. And that's all good.
Yeah.
So good job, Francis, for holding it down
Yeah.
over
Shout out to Fran. Yeah.
All right, good. So I just want to give a few updates on what's going on with COVID in general. But today's show, we're really going to be talking about like the impact of childhood vaccines. We want to point out one in particular, chickenpox. But before we go into that, let's just talk about a few things. So I was reading recently that the government is about to put all them COVID bills for vaccines, for testing, doctor's visits, hospitalizations, anything related to COVID is about to come off the government bill and go over to private health insurance. So health insurance companies will be picking up the cost. And so people who do not have health insurance, unfortunately, they're going to fall through the cracks like they have for every other disease. And we know who those people are. They're usually Black and brown people who remain uninsured, low income people or they are in a weird part of the income. They're not low enough to qualify for Medicaid, but they don't make enough money to be able to afford insurance premiums, not even through healthcare.gov. And so there's a lot of people that remain uninsured or underinsured. And the government's COVID money is like running out, or it may already be out. So that's that. So I'm saying take advantage of the testing, the treatments, the vaccines that are available now, because soon it'll be picked up by private insurance like all other health conditions. That's a
Wow.
little scary.
Wow. Yeah, Doc, that is scary. I mean, because it was like people that had that was one of the reasons. Why are they giving that out for free? And it's
Well,
like,
it ain't gonna
yeah,
be
it's
free
like,
for long.
you won't be able to say that. I mean,
You
it
ain't
was
gonna pay
because
for it.
it was a disease that took over the world, and they actually was doing us a courtesy.
Yeah, they had to, because they had to get people. They didn't want there to be a reason why people couldn't get vaccinated, because they're paying the bill. So it's
Right.
like, I'm paying the bill. I'd rather pay $20 to get you vaccinated than $200,000 from a hospital bill. So that's why they were given away for free, because it cost them less money to prevent you from getting COVID than to pay for you to be in a hospital and sick forever, driving up healthcare costs. You can always follow these decisions back to the money. But the government only has so much money that they can allot to this, or that they will allot to this. And that money is like done. So all these free clinics, I mean, that's going to affect us too, because the money that we get to run these types of programs and to get providers to come out and to pay people to go out and do COVID outreach education, that's all tied up with the same money. Yeah. So once it's gone, it's gone. So take advantage of the free community offerings, take advantage of the testing, because all of that will be going to private insurance, which means if you don't have insurance, you'll be paying out of pocket. If you do have insurance, you'll be paying your deductible, you'll be paying your co-pays. And that's just that's what it's going to be. COVID's not going anywhere. Man. And insurance ain't going to pick up the bill forever. So that's where we're at with that.
Wow.
I mean, the government is not going to pick up the bill forever. So that's where we're at with that. So we'll see how that turns out. We talked a little bit about the COVID restrictions. I can't remember, but the CDC dropped a lot of the restrictions right in time for school. So no quarantining anymore. If you're exposed to someone that has COVID, the recommendation is just to test on day 5. So just get tested, see if you have COVID on day 5 after being exposed to someone that has COVID. But you don't have to quarantine just because you were exposed. It's only people who have COVID, who have a positive test, have to stay home for 5 days and then mask for an additional 5 days if you have COVID. But if you live with someone, if you're exposed, they're recommended to test on day 5 and see what the result is. If you get symptoms after day 5, then you test again, just to make sure that you're not out spreading it. But all that closing down classrooms because somebody got COVID, all that is no more. It's over. They don't have any recommendations for social distancing anymore, so that's gone. The masking, we know, is a voluntary thing. For me, I always kind of operated like I didn't need the government to tell me to mask. I know that there's a disease that spreads when people are in close contact with each other. It's a respiratory spread, so I'm just going to have my mask on anyway. So that really didn't impact me too much, but a lot of people have been choosing to not wear their mask, and that's totally fine, especially if you're vaccinated. I'm not judging anybody, but people that's not vaccinated, I would just say to protect yourself as much as possible. And if that means put a mask on, as long as it's not causing you harm, you can't breathe, you're okay, just put the mask on just to save you from having a bigger sickness later. I don't know. What do you think about the mask and thing, George?
I'm not a big fan of the mask. I'm kind of one of the people that really don't wear them unless I'm in a hospital or some type of facility or something of that nature, or somewhere that requires it.
Yeah.
But I wasn't a fan. Right. I'm vaccinated, but I really was like that mask thing. I felt like I couldn't breathe. It was like, it was the worst feeling in the world. But I get it. I get why, but it's crazy because I always bring up this scenario with Michael Jackson. Michael Jackson used to wear a mask all the time.
It's like, y'all ain't messing up my singing voice.
Like when he was traveling, he was like a germophobic type of guy, and it was funny. Like, wow, Mike looked crazy, and now we over here with masks. It's kind of our norm, and it's just like, wow. But I get it. You have to do what you have to do. I would just recommend it for people that choose to go against the vaccination. That should be a part of your arsenal.
Yeah.
You should definitely be masked up in public places. Because there's still people that still against the vaccination, which is fine. But I also will protect yourself with the mask, the hand washing, and the things that that was told for you to do to be able to combat the COVID, because it's bad. It's bad.
Yeah. So you can't just do nothing. You can't not get vaccinated and then not wear a mask and then not wash,
right,
your hands clean. You have to do something to protect yourself. So hopefully y'all are doing something if you're still not vaccinated. But there's a booster coming out this fall. So the Omicron booster should be available. The FDA is going to be meeting on September 1st and 2nd to discuss who's going to get it. So it's already made. It's already being shipped out to places, but we just don't know who's going to get it yet. I know that Pfizer requested 12 and up and Moderna requested 18 and up. So we'll see what the FDA decides. And then once they come out with their guidance, it'll go over to the CDC, and the CDC will put out a recommendation on what we should do. So we'll see what happens with that. But that's the Omicron specific variant, and that's variant vaccine, and that's because that's the virus that is mainly in circulation right now. It's the BA.5, which is a subvariant of Omicron. So that's a component of the vaccine. It also has the original strain of the vaccine as a part of the original strain of the virus. I'm sorry, I'm using the wrong words. The BA.5 is a subvariant of the Omicron virus variant, which originated from the original vaccine virus. I'm still getting the words messed up.
Right.
So that's a part of the new vaccine that's coming out. The new vaccine will also have protection against the original strain of the virus as well. So it's a couple different strains that's in this new vaccine that's coming out this fall.
Okay.
But the good thing is that the original vaccine it still works. People that are being hospitalized and dying from COVID, the overwhelming majority of them are people that have not been vaccinated. So we know that the vaccine is keeping people out of the hospital and keeping them from dying, which is a big deal. Mm-hmm. So there are some scientists who are like, it's really no point in doing the Omicron specific because the original one is still working. But then there's hoping that we can get the transmission rates will go down and people won't get as sick if they get the Omicron specific booster, since that's the one that everyone's getting now.
Right.
What you think, George?
I noticed there's been an increase in numbers.
Yeah.
I mean, people even with the vaccine and the booster, I'm noticing like within the last, I'm gonna just say the summer, the numbers have went up. I mean, we're interacting more. It makes more sense, but it also means to be have your defense against it. For me, I'm definitely going to get the booster. I think I just got the first booster. I didn't get the second one, but I'm more concerned with this one going into the winter.
Yeah.
And being able to fight off the latest stages of COVID.
Yeah, and the reason that you didn't get the second booster is because you don't qualify for it. So the second booster was only recommended for people that's 50 and above, so age 50 and above, or have other health conditions that make them at risk. And that's mostly immune compromising conditions. So because you don't qualify for it, that's why you didn't get it. So you're up to date. You good.
Right, I'm good. I'm feeling good.
So we're gonna be waiting for the We're going to be waiting for the FDA and the CDC to say, who can get the Omicron booster? Because I'm wondering, people that have not been vaccinated yet, are they eligible to get the Omicron specific vaccine, or do they have to start off with the original one and then they wait a period of time and then they get the Omicron? So just kind of wondering what they're going to do and who they're going to say is for. Dr. Thomas, have you heard anything?
No, I haven't heard anything in addition to what you said, but I do also agree about I would get the booster because this is kind of the way the flu shot has been working for years, where you get the new, vaccine every year and it covers whatever the most predominant strains are. So I think we're probably heading into this similar approach to, the COVID vaccine as well. So, yeah, but I haven't heard anything new. You're teaching me. I'm taking notes right now.
Oh, man, I'm teaching the doc.
Dr. Wisdom back there.
There's so much information that comes out, and it's just like it's a lot. So I'm gonna try to keep up with it the best I can, so I can let y'all know.
Right.
Let me take a sip of water before I go on this next rant.
You just can't help it. So in that camera.
I know, like, camera, come on, start coughing, body. Start.
Okay.
All right, so first of all, I want to shout out everybody that's in the chat. Hi, everybody. Thanks for
Going on, Josh.
I see Josh. I see Mattios. I see Shalom. I see a lot of activity. So thank y'all for tuning in to Keeping It 100. Also, next on our agenda for today, I want to talk about the history of vaccines, like the impact that they've made. So this has nothing to do with COVID, this part. I just really want to be talking about have vaccines like made a difference? We've been vaccinated as children. We have been vaccinated our children, and we just kind of did it because it was just a part of the routine physical child experience. So what I'm seeing now is a lot of people are like, I'm not going to get vaccinated. Like, I'm not vaccinating my child against this COVID shot. Like, I'm not doing this. And so I wanted to see, has all these vaccines that we have been getting ourselves and kind of giving our children, especially the small children, has that been making a difference? I took Bria to get her physical exam on Friday, and the doctor came in and was like, oh, she's due for 2 vaccines. I was like, oh, she is? I didn't even realize that. Wow. And so Bria got her Tdap vaccine, and she got a meningitis A vaccine when she went to the doctors on Friday. And she got them at the same time and the same arm, and the girl is fine. So these are things that have been happening for decades. So this whole concept of there's a disease that is a threat, we need to vaccinate the kids and adults is not a new thing. So just wanted to kind of point, just talk about that a little bit. I know that the fall's coming up and it's time to get the flu shot, like Dr. Thomas said, and we may be getting some COVID boosters. So can we get them both at the same time? And the answer to that is yes. And I think that Dr. King talked about that last week. Like, our bodies can handle multiple vaccines at the same time. It's not a thing. Like, it is equipped to deal with it. I know that when Bria got her shots over the weekend, we had a video. I'm not sure if we're able to show it. But when she got her shots on Friday, she got a Tdap, which has 3 vaccines in 1 shot, and she got a meningitis A, which has 1. So it's essentially she got 4 vaccines all at the same time.
Wow.
And so that's not uncommon. That happens all the time. Like, even with little babies. Bria's 11, but it's the same thing that happens with babies. We provide the vaccines that they need so that they don't have problems, health crises growing up. So I just wanted to talk about chickenpox a little bit. Because when we were young, chickenpox, like, everybody got chickenpox. Everybody got chickenpox. I had chickenpox. Did you get it too, George?
Oh, yeah. I mean, it was common. I mean, it was like a common disease to get. I mean, everybody was basically waiting for you to get it. And then after you got chickenpox, that was it. So, I mean, yeah. I think I had it twice, actually.
Oh, really?
Yeah. Like, once when I was younger, and then once when I was like a preteen or in my teens. I had caught it twice.
Okay. Yeah. Wow. And that's, and that's not uncommon either. We kind of can see that with COVID. People are getting COVID multiple times. And so that's just how viruses work, or how your immune system works, is that it protects you for a certain amount of time, but it may not protect you forever. And so that's why you have to get multiple doses. You have to come back and get boosters to keep you protected. But back in the day, 4 million people in the U.S. a year would get chickenpox. 4 million people. We ain't heard about a case of chickenpox since I don't even know when. But back then, 4 million a year were getting it. It caused about 10,000 people each year to go to the hospital. So it's not the chickenpox itself, it's the complications of chickenpox that will have people go to the hospital. So if the pox, if like the little bumps get infected or inflamed. Or depending on where the chicken pox starts to develop, if it's in the mouth, it can cause problems that could wind you up in the hospital. So 10,000 people a year would be hospitalized because of chickenpox, and about 100 to 150 people died each year from chickenpox.
Wow.
Now, we haven't heard anything about chickenpox in a long time. That's because in the mid 90s, a vaccine became available.
Mm-hmm.
And so this shows the power of vaccines. Like, they work. And I think it was like 95, 96. Dr. Thomas might be able to look at that up. But the vaccine became available because I was wondering, like, why did I have chickenpox? I was like, why? I was like, was my mom some kind of anti-vaxxer? But I was born in the early 80s. And so when I was born, it just wasn't available. But in the mid 90s, it became available, and we got vaccinated. And we vaccinated our kids. And so that's why you don't hear about it now. And so just kind of having that conversation to show the power of vaccines, they work. George, you want to talk about your experience or what you think about the fact that we're not even really talking about chickenpox anymore?
Well, I mean, like, you know, when I had it, but, you know, like when my kids got, you know, old enough to start getting their vaccinations or whatever. Actually, you start getting vaccinations as soon as you're born. So
hepatitis B, you come out the womb,
right, you get it even before you leave the hospital. So it's like just procedure. So, and I just know we didn't contest anything at that time. I mean, I understand what the hesitancy would be as far as, you know, just people feeling weary, like Brother Antoine, you know, he said he doesn't intend to get it. That's fine.
Yep.
I just know we have been putting vaccinations in our system for a while. So, you know, and we really didn't question them. Even if they were already in rotation and it was a simple routine, we still never question them. We'll go to the doctors and the doctor to be like, well, your baby got to get 4 shots a day or 3 shots or 3 in each leg. They'll let them put them in there with no problem. So I'm just saying, you know, like we came a long way, though. I mean, we came a long way. I mean, medicine is like way more sophisticated. You know, we have a better like understanding of certain things. We see how we can maneuver around these diseases, and we just pretty much going in the right direction. So I'm confident with the procedures and how we move around. I'm not leery because I trust the scenario and the market of doctors and how far we became, or you know where we at right now.
I think that a part of the difference, so yes, we didn't question it before, but now I think number one, we have access to more information. It's like in front of us all the time. And because of social media and because anybody can say anything about anything, is more bad information that's being circulated than good information. So people are being exposed to things, you know, hearing about stuff that's just not true. And they're taking that in and they're processing it as a thing that could be true. And they don't hear anything to combat it. So it's like, well, it must not be a good idea to do this.
Mm-hmm.
And so because of all the information, and then remember when COVID started, who was president at that time? So he was a very controversial figure. Who was going to believe anything he said anyway?
Right.
And so I think it was a perfect storm for people who are skeptical, like Black people, to make a decision to not get vaccinated because we already had trust issues with the government, trust issues with the healthcare system, trust issues with the pharmaceutical company. So it was like a perfect storm for us to not like to question it in a way that we hadn't questioned stuff in the past. Right. So I get it, but I think what we need to do is we need to get the facts and get information and not put ourselves at risk of being harmed from a disease that can be prevented by vaccine. Now, if you have a healthy regimen and you're doing things to keep your body and to keep your family's body, you know, in the best I guess, state to combat viruses and to combat bacteria, I think that's your next best alternative. So if you're not going to get the vaccine, then just be doing those healthy things. You got to do something. You can't just not do anything.
Right.
When you know something out there, you just can't not do anything. So staying healthy is your next best bet. Absolutely. Absolutely is. I wanted this to talk a little bit really quick before we wrap up about rotavirus. So I don't know if anyone is familiar with rotavirus, but that's a disease that spreads easily in children, especially in daycare centers, and it causes kids to throw up. It causes them to have diarrhea, and because of that, it was causing a lot of kids to go to the hospital because of dehydration, because they couldn't keep anything in. They were like always vomiting, always had diarrhea. They couldn't keep fluids in, and it caused a lot of death, and it caused a lot of dehydration. There was a vaccine that came out, I think in the 90s or early 2000s. Dr. Thomas can back me up on this, but a vaccine came out and it worked. It helped to keep the kids healthy. If they got rotavirus, like, they didn't end up in the hospital, and it worked great, except it had a problem. And the problem wasn't brought up until after it was on the market for about a month. But parents were reporting that kids were having really bad stomach pain. And when they took them to the hospital, what they found was that they were developing a condition called intussusception. And so what happens with that is that the intestines become inflamed and start to like fold into itself. And so that causes a lot of pain. And they found that the vaccine was causing that. That was coming up about a month after the kids were vaccinated. Wow. And so when I say stuff like, I'm not getting my kids vaccinated when something first come out, is because of stuff like that. Because I want to make sure that nothing rare is going to come up once we start to vaccinate hundreds of thousands of people. But the good thing is that when a bad side effect happens from a vaccine, in the history of vaccines, it comes up within 2 months. So that's why, like, I'm always trying to wait at least 2 months, and I'm always trying to wait until at least a couple 100,000 people got vaccinated, so I can look and make sure that, okay, I think we're in the clear now.
Right.
So they pulled that vaccine off the market because once enough people were reporting it, and there is a system called the VAERS system. It's the Vaccine Adverse Event Reporting System, where parents, where patients and doctors, whoever, can call into the system and say, hey, like, I got this vaccine and this is happening. And the system will keep track of what's happening. And if they see stuff that starts to pop up repeatedly, then they start to look into that data to see if it's really a problem that is being caused by the vaccine. And that's what happened with the rotavirus vaccine. They pulled it from the market, and it was not available now. So when you're looking at COVID, you're looking at billions of people that have been vaccinated, and all the information that's gone in to the system about the side effects. We know that these vaccines are just incredibly safe. They are incredibly safe. Trust me, it would have been pulled from the market by now. It did not take long for them to realize that rotavirus vaccine needed to go. And as soon as they did, they pulled it. Now, a new one came out a few years later, hasn't had that problem. But I just want y'all to know that they are looking for data. Like, they are looking at this data. They are not going to keep something on the market that is not safe. They are just not. So there's an example of when they had to pull something from the market.
Yeah. I didn't even know that either. Wow.
I forgot to tell you, my bad.
Yeah. No, that's good stuff though, Doc. I mean, like, that makes sense. I mean, like you say, like, they don't want to hurt us.
No, they don't.
They wanted everything to get up and running, but they knew something had to be done, and it was done. And I know it sounds like we just repeating ourselves for weeks and weeks and months, but we have to keep repeating these things to try to catch up and be caught up in our health and wellness and welfare. I mean, that's the big thing. We don't want to wait till it's too late. We don't know what COVID is going to do to you until you get it. Yeah. So you don't know how it's going to affect your body. You don't know what what it's going to attack. Even if you never got it for the last 2 years, you could get it one time and be down. So, I mean, just knowing that is scary. Like, it's just like anything. Like, a car wreck, you don't know what's the condition of what you're going to be in if you're in a car accident. So it's just about being prepared. Like Pierre said, that's just the vaccine is our seatbelt.
It's your seatbelt.
It won't stop the accident, but it can prevent a severe situation, you know. So.
Yeah. Exactly. So when you look at the history of vaccines and all the vaccines, by the time a child is 1 year old, they already have multiple doses of 6 different vaccines. You know, we are doing a lot to protect our children from having the diseases that were out before us and when we were young. And you don't hear about this stuff because the vaccines are working. And this is not the last time that the vaccine is going to be needed. So we got to make sure we get the information and know how to find and trusted information so we can make decisions to keep ourselves healthy. But we have some events coming up this weekend. Georgie, where we going to be?
Woo, we all over the place.
I know.
Let me pull out my Rolodex. Hold on.
Pull out your Palm Pilot.
All right. So we got 2 events on Friday. One of them will be in Derby, and that will be at there's the flyer. Thank you very much. That will be at the Helen R. Thomas Soccer Field at 7th and Pine, and it's going to be hosted by the Renation and Third Ward Council members and friends. And basically, it's a community event with all kinds of fun games, great sponsorship. We're actually going to be doing vaccinations at this one. So come on out, get your kids vaccinated. Let's get ready for the school year. Looking forward to that event. Then we also have an event with City Team. I don't believe we have a flyer for that one. No, that's the Saturday event. But we also have an event on the same day between 4 to 6 at Subaru Park. And that's the backpack giveaway with Making a Change group combination with City Team. Major event. I worked it last year. We have a table there. We won't be doing vaccinations, but we will have plenty of information and just anything that you might, or any questions you might want to know going forward, vaccinated or not. So come through, check us out. We have coverage on both of those events. Then we're moving on to Saturday. We're going to be in Trainer. Trinity is a Trinity Transitional House Festival. I believe they do this annually. It's going to be at Henry Johnson Park, and that's between 11 and 5. We'll have a table there, information table. We won't be doing vaccinations, but we will be doing vaccinations on the east side.
Yes.
You can show that flyer now, guys. We're gonna be over the east side at Sisters Market, right across from Moose's Barbershop, right there. Shout out to Moose. He's helping promote and give us good feedback on what's going on in the community over there. We're kind of catering to the Hispanic community. We want to start bringing some awareness around that area. It was actually Doc's idea. I think it was a great idea. We're giving out backpacks and we're also doing vaccinations. There we go. And we're giving out vaccinations, boosters, and backpacks. So shout out to Daisy. She helped us put this event together. Doc, we're going to have some good music.
It's gonna be fun. Like Daisy's with the Hispanic Resource Center with the Foundation for Delaware County. So this is a part of what she does a lot of research out to the Hispanic community in Chester and in Delaware County. So we're really glad to partner with them on this one.
Right.
Yep. And then
I think we got one more on Sunday, which is Subaru Park. That's Senator Kane. Same thing, backpacks. We just backpacked out. I feel like Bora or something. But it's just next year we just gotta all come together for these backpack events. I'm not disrespecting them, but it's just a lot of them in the same places, and next year we just need to come together. But we're working with Senator Kane. Shout out to Senator Kane. He's giving back in the community at Chester. We're doing backpacks. With that also will be event information table. But you could come out and see all of us. Our whole team will be there that day. Come up to the dock any questions you might have, any health questions. She'll be available on site and for autographs.
Pop. Shut up. Nah, it's going to be a good day. So we got a busy weekend, but we're going to have fun, and we'll just be out in the community doing what we do. So thanks, everybody, for tuning in today. If you need somewhere to go get vaccinated, you can always go to vaccines.gov. If you're in Chester, covidinfo.org, or if you're in Delaware County, delcopa.gov/COVID. So go get what y'all need from where y'all need it. And we'll see y'all this weekend.
Thank you, everybody. Thanks, Ty. Thanks, Pete. Thanks, Les.
Bye, everybody.
All right. Whoa. Yo.
And so I think it's important that you understand the clinical trial process. I'm not saying the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated, or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.